by Charina Clarice Alachaluche. Representatives from overseas Filipino workers OFW organizations were consulted on the proposed measures to ensure the sustainability of the National Health Insurance Program (NHIP). In a dialogue initiated by the Philippine Health Insurance Corporation Philhealth, the OFW representatives shared their concerns on the planned increase in the premium contribution rate starting 2018. Dr. Narissa Portia J. Shugay, Philhealth official, who is the OI Vice President for Member Management Group, explained that Philhealth is moving towards universal coverage. Hence, there is a need to expand its coverage to those who are not yet covered by Philhealth, including migrant workers. She added that for the past years, without increasing the premium contribution rates, the agency were able to enhance its benefit packages to make these more responsive to what Philhealth members needed. For instance, she noted, the Z benefit packages provided substantial coverage for such conditions as acute lymphocytic leukemia, early breast cancer stage 0 to IIIA, prostate cancer low to intermediate, kidney transplantation for end-stage kidney disease standard risk, tetralogy of Fallot, closure of ventricular septal defect for children, cervical cancer stages I to IV, and the Z-morph mobility, orthosis, rehabilitation and prosthesis help, among others. Kung natatandaan po ninyo, yan yang malalaking benefits na hundreds of thousands ang binabayading Philhealth for some diseases or illnesses na kung hindi kami imbrowing programa, nakaubos talagaing resources in pamilya para lamang mabigyan ng karampatang treatment ang pasyente, she stressed. Universal Health Coverage. Narissa R. Santiago, Philhealth OIC Senior Vice President for Actuarial Services and Risk Management Sector and concurrent Vice President Office of the Actuary, presented the Philhealth's financial status and some projections for the sustainability of the program, explaining the three dimensions of Universal Health Coverage UHC. One dimension is the coverage rate or the coverage ratio of Philhealth. She said that as of December 2016, Philhealth already covered 90% of the population. The second dimension is the expansion of Philhealth benefits to include the implementation of the primary care benefit package to other member sectors. The third dimension, she said, is the increase in contribution scheme which was approved by the Philhealth Board of Directors for 2018. Under the new scheme, the premium contribution of the land-based OFWs will increase from P2,400 to P3,600 per year, while the sea-based OFWs who belong to the formal sector will have a 0.25% upward adjustment from its contribution rate of 2.5%. Santiago stated that from 2016 to 2026, the gap between the contribution and benefit expenses is increasing. Hence, funds may not be sustainable for the next 10 years if Philhealth maintains its status quo. This is the reason why we are adjusting the contribution scheme, she clarified. OFW's calls. Meanwhile, the OFW representatives called for a deferment of the premium increase to 2019 in light of current economic conditions in some countries. They appealed for an improvement of Philhealth services and benefits for their sector, and for Philhealth to explore other possible sources of funds. Some representatives also recommended that Philhealth should take note of the concerns raised by OFWs in Philhealth's official social media sites, and for the government agency to be more active in the pre-departure orientation sessions. Tags. Dr. Narissa Portia J. Shugay, National Health Insurance Program, OFW, Philhealth. Philhealth OFWs discuss nat'l health insurance program issues.